Imagine a world where every move you make sends shooting pain throughout your body. You stop going out with friends, you stop enjoying the work you do, and you stop doing activities with your loved ones, all because you feel trapped in a world of pain and discomfort. Well, that's the case for 4 million Australians, or 1 in 7 adults, that suffer from chronic neck pain. And the problem is these people can suffer from chronic neck pain for years, all because there are a variety of causes, like injuries or repetitive movements can cause strain and tension on the neck, causing chronic neck pain. Degenerative changes in the intervertebral disc, facet joints, and spinal ligaments can cause irritation or compression on the nerves, causing chronic neck pain. Emotional stress can cause tension in the neck, causing chronic neck pain. Poor posture, like prolonged sitting or forward head tilting, can increase tension on the neck, causing chronic neck pain. So there are a variety of factors that can cause chronic neck pain. Yet the best therapeutic treatment is still undefined, because most people are prescribed a combination of drugs, physiotherapy and exercise. And because the best therapeutic treatment is still undefined, I wanted to try and define it by figuring out what's the most effective treatment for chronic non-specific neck pain. And with the hope of trying to clarify this for myself and other healthcare professionals when treating chronic neck pain. So the way I did this, I first identified meta-analyses using PubMed. I used search terms like chronic neck pain or chronic non-specific neck pain, and treatment or exercise or physiotherapy or pharmacology, not back pain or cancer or headaches. I included articles that assess pain using the visual analog scale, and they also describe chronic neck pain as pain greater than 3 months in the lateral posterior parts of the neck. I excluded articles that weren't assessing treatment, so some assessed cause of injury, and I also excluded articles that had a paywall. And what I found was that exercises, doing strength, flexion and isometric exercises led to the biggest reduction in pain after 6 months, because isometric exercises create an analgesic effect, and the strength exercises strengthen the muscle, and the combination leads to an increase in the pain threshold for the individual. However, aerobic exercise actually led to an increase in pain at the local sites of the neck, but reduction in pain to other areas of the body. For physiotherapy, it was effective for immediate short-term pain relief, but not statistically significant in terms of long-term pain reduction. However, a combination of physiotherapy and exercise was the greatest reduction in pain from all the studies I looked at. However, this meta-analysis had a high risk of bias. For cognitive behavioral therapy, there was no difference between that and any other interventions. However, in terms of reducing pain, there was a statistically significant improvement in function as people had less fear of doing movement. For pharmacology, there was no difference between analgesics, epidurals, and a control group after 12 months in terms of reducing their pain, but there was a statistically significant improvement in function, but that did come at the cost of side effects related to people's immune health. So the strengths of all the articles that I looked at most of them assessed 2 primary outcomes, which was reducing pain and improving function. So something like CPT didn't reduce pain, but it improved function, and so potentially you could combine that with exercise that did reduce pain. They also were meta-analyses. They had the strict exclusion criteria. So a lot of articles excluded variables that had confounding effects on the intervention they were specifically looking at. In terms of the limitations, because they used the visual analog scale, most of the individuals assessing their own outcomes. So they were assessing their pain using a subjective assessment, so it was difficult to blind them. Another limitation was the fact that for most of the physio meta-analyses, they didn't have follow-up studies on the studies they selected, so they just had their intervention and they didn't follow up afterwards. In terms of future research, trying to increase sample sizes, most of the studies only looked at less than 50 people, so trying to increase that to increase the confidence of the results. Also, testing the frequency of the exercise to try and find out if there is an optimal frequency for improving or reducing chronic neck pain, and conducting follow-up interventions post-assessment, specifically for the physiotherapy, just to improve validity of the assessment and patient outcomes. Now, I hope you enjoyed today's video. I hope you found this a bit insightful into what the current research says about chronic neck pain, what you can do about it. Trying to focus on doing those strength isolation exercises on the neck, doing isometric and deep neck flexor exercises, and potentially using that with a combination of CBT or physiotherapy shown to be the best treatment for chronic neck pain. Now, I hope you enjoyed today's video. If you did, please subscribe, and I'll see you again in the next video.